If you are over 60 and living with arthritis, there is something happening on your plate every single day that most doctors never mention, and it is making your joint pain worse than it needs to be. Not because of anything dramatic, not because you are eating something obviously harmful, but because there are specific foods that tens of millions of adults over 60 eat regularly, foods that seem harmless, foods that are marketed as healthy, foods that have been on their table for decades that are quietly, consistently, pouring fuel on the inflammatory fire that is burning inside their joints. Today I am going to show you exactly which 7 foods are doing this, and I am going to show you what to eat instead. Not a vague list of things to cut out, a specific food-by-food replacement guide that tells you what the science says about why each food worsens arthritis, what the mechanism is, and what the research-supported alternative is that gives you the same satisfaction without the inflammatory consequence. If you are over 60 and managing arthritis, this information could be the most practical dietary guidance you have ever received. And if you want more evidence-based health content like this specifically created for adults over 60, subscribe to this channel right now before we dive in. We publish real science, explained clearly, every single week. Hit that subscribe button and never miss a video. Let us start with the biology, because understanding why certain foods worsen arthritis is what transforms this from a list of rules into a framework you can apply to every food decision you make. Arthritis pain, whether from osteoarthritis or rheumatoid arthritis, has an inflammatory component that responds directly and measurably to what you eat. The inflammatory cascade in arthritic joints involves the same molecular pathways that dietary compounds activate and modulate: the NF-κB transcription factor that drives production of inflammatory cytokines, the cyclooxygenase enzymes that produce prostaglandins, the lipoxygenase enzymes that produce leukotrienes, and the NLRP3 inflammasome that responds to specific dietary triggers by amplifying the inflammatory response in the synovial membrane. Every food you eat sends molecular signals through these pathways. Some foods suppress them, creating an anti-inflammatory environment that reduces joint pain and slows cartilage degradation. Others activate them, adding to the inflammatory load that arthritic joints are already struggling to manage. For adults over 60 with arthritis, the distinction between these two categories of food is not academic. It is the difference between a manageable day and a difficult one. The 7 foods we are about to discuss are not obscure or unusual. They are among the most commonly consumed foods in the American diet. And for every one of them, there is a direct, accessible, affordable replacement that provides similar enjoyment with dramatically less inflammatory consequence. The first food to stop eating if you have arthritis and are over 60 is refined sugar, and specifically the concentrated added sugars found in sweetened beverages, desserts, packaged sweets, flavored yogurts, breakfast cereals, and the dozens of processed food products where sugar is added under names including high fructose corn syrup, dextrose, maltose, cane syrup, and evaporated cane juice. Refined sugar activates arthritis inflammation through multiple simultaneous mechanisms. Fructose, particularly high fructose corn syrup, is metabolized in the liver and produces uric acid as a byproduct. Elevated uric acid levels directly activate the NLRP3 inflammasome in joint macrophages and synovial cells, triggering the release of interleukin-1 beta, one of the most potent inflammatory cytokines in arthritis pathology. A landmark study published in the American Journal of Clinical Nutrition following over 100,000 women found that daily consumption of 1 or more servings of sugar-sweetened beverages was associated with a significantly higher risk of seropositive rheumatoid arthritis, with the inflammatory mechanism attributed specifically to fructose-driven uric acid elevation and the advanced glycation end product formation that high sugar consumption produces in joint tissue. AGEs bind to specific receptors on synovial cells and chondrocytes, triggering the inflammatory cytokine production that directly damages cartilage and amplifies joint pain in adults over 60. Eat this instead: dark chocolate at 70% cocoa or higher, fresh fruit in moderate amounts, small amounts of raw honey or pure maple syrup, and naturally sweet foods like dates and dark berries that provide sweetness alongside fiber and polyphenols that moderate their inflammatory impact. The second food to stop eating if you have arthritis over 60 is refined white flour products: white bread, white pasta, white rice, commercial crackers, pastries, and the ultra-processed foods that use refined wheat flour as their primary ingredient. Refined flour products are digested and absorbed rapidly, producing the blood glucose spikes that promote age formation in cartilage collagen and trigger the insulin response that upregulates inflammatory cytokine production. A study published in the journal Nutrients found that dietary glycemic load was significantly associated with serum levels of C-reactive protein, and interleukin-6 in adults with osteoarthritis, with higher glycemic load meals producing greater post-meal inflammatory cytokine elevation in arthritic joints. Eat this instead: steel-cut oats, barley, quinoa, whole grain sourdough bread made with long fermentation, brown rice, and sweet potatoes, which provide the carbohydrate satisfaction of refined grains with dramatically lower glycemic impact and the fiber that feeds anti-inflammatory gut bacteria. The third food to stop eating if you have arthritis and are over 60 is processed red meat, specifically the cured, smoked, and ultra-processed forms, including sausages, hot dogs, deli meats, bacon, and processed meat products where nitrates, preservatives, and high-temperature cooking methods create the specific inflammatory compounds most damaging to arthritic joints. The nitrosamines formed from the nitrates and nitrites used in cured meat preservation directly activate NF-κB signaling. The heterocyclic amines and advanced glycation end products produced by high-temperature cooking of processed meats accumulate in joint tissue and trigger the RAGE receptor signaling that amplifies synovial inflammation. A study published in the Annals of the Rheumatic Diseases found that higher consumption of red and processed meat was associated with greater rheumatoid arthritis disease activity and higher inflammatory biomarker levels, with the association stronger for processed meat than for unprocessed red meat. Eat this instead: unprocessed lean poultry, fatty fish including salmon, sardines, and mackerel 2-3 times per week for their EPA and DHA anti-inflammatory benefits, eggs, and plant proteins including legumes and tofu, all of which provide equivalent protein with dramatically lower pro-inflammatory impact. Before we continue, are any of these first 3 foods a regular part of your diet? Drop a comment below right now and be honest with us. You are not alone. Most adults over 60 with arthritis are consuming at least 2 of these 7 foods daily without knowing the inflammatory mechanism behind them. Your honesty here helps this community understand what changes make the biggest difference. We read every comment. The 4th food to stop eating if you have arthritis over 60 is vegetable oils high in omega-6 fatty acids, specifically soybean oil, corn oil, sunflower oil, safflower oil, and cottonseed oil, which drive the omega-6 to omega-3 imbalance that is one of the most consistent dietary predictors of arthritis severity. The omega-6 fatty acid linoleic acid in these oils is converted to arachidonic acid, the direct precursor to the most pro-inflammatory prostaglandins, thromboxanes, and leukotrienes in the arthritis inflammatory cascade. Research published in the journal Inflammation found that reducing dietary omega-6 intake and increasing omega-3 intake significantly reduced inflammatory biomarkers and joint pain scores in patients with rheumatoid arthritis over a 12-week dietary intervention period. Eat this instead: extra virgin olive oil for dressings and low to medium heat cooking, whose monounsaturated oleic acid is stable at moderate heat and whose oleoconthal polyphenol content directly inhibits COX2 inflammation, and avocado oil for higher heat cooking. The 5th food to stop eating if you have arthritis and are over 60 is high-fat non-fermented dairy, specifically full-fat cheese, butter, and cream, which contain arachidonic acid directly in their fat fraction and contribute to the saturated fat load that research associates with elevated inflammatory biomarkers in arthritic adults. The specific concern is with high-fat, non-fermented dairy products that provide the arachidonic acid and saturated fat without the probiotic benefit that fermented dairy provides. Eat this instead: plain low-fat or full-fat Greek yogurt and kefir for their probiotic benefits, reduced portions of aged hard cheeses which have lower inflammatory profiles than processed cheese products, and fortified plant-based alternatives including oat milk and almond milk for calcium and vitamin D without the saturated fat load. The 6th food to stop eating if you have arthritis over 60 is alcohol, and particularly the daily or near daily moderate consumption that many adults over 60 consider harmless or even beneficial based on the anti-inflammatory headlines about red wine and resveratrol. Alcohol is directly metabolized to acetaldehyde, a compound that activates NF-κB signaling and promotes inflammatory cytokine production in joint tissue. Even moderate alcohol consumption elevates uric acid levels, the same uric acid that activates the NLRP3 inflammasome and amplifies joint inflammation. And alcohol disrupts the deep, slow-wave sleep stages during which growth hormone-mediated cartilage repair and anti-inflammatory resolution occur. A study published in the journal Rheumatology found that even moderate alcohol consumption was associated with higher disease activity scores and elevated inflammatory markers in patients with rheumatoid arthritis. Eat this instead: tart cherry juice for its melatonin and anthocyanin content that provides evening relaxation and anti-inflammatory benefits without the inflammatory consequences of alcohol. Sparkling water with lemon or lime for social situations, and herbal teas including ginger, turmeric, and chamomile for evening anti-inflammatory benefit. The seventh food to stop eating if you have arthritis and are over 60 is ultra-processed food, broadly the category of packaged products that have been industrially processed to include artificial flavors, colors, emulsifiers, preservatives, and combinations of refined oils, refined flour, and added sugars that are not present in whole foods. Ultra-processed foods represent approximately 60% of calories in the average American adult diet, and their specific impact on arthritis severity operates through multiple of the mechanisms we have already discussed. The omega-6 overload, the glucose spikes, the NLRP3 activation from fructose, the NF-κB stimulation from artificial additives, and the gut microbiome disruption from emulsifiers that eliminates the butyrate-producing bacteria, whose metabolites suppress synovial inflammation. A study published in the journal Nutrients found that dietary ultra-processed food consumption was significantly and independently associated with higher serum inflammatory markers CRP, IL-6, and TNF-alpha in adults with musculoskeletal conditions including arthritis. Eat this instead: whole foods in minimally processed forms, fresh vegetables, fresh fruits, whole grains, legumes, eggs, fresh meat and fish, plain dairy that provide the nutrients, fiber, and bioactive compounds that protect joints while absent the industrial additives that inflame them. The gut microbiome dimension of arthritis management, and specifically how the 7 foods we have discussed disrupt the microbiome in ways that amplify joint inflammation, deserves explicit explanation. The emulsifiers found in nearly all processed foods have been shown in research published in the journal Nature to disrupt the mucus layer of the intestinal wall and reduce gut microbiome diversity, reducing the populations of butyrate-producing bacteria, whose metabolites are among the most potent natural anti-inflammatory signals in the body. Refined sugars selectively feed pro-inflammatory bacterial species while depleting the bifidobacterium and lactobacillus populations that support immune regulation. The replacement foods we have described: whole grains, berries, olive oil, fermented dairy, legumes collectively support the opposite microbiome composition, high in butyrate-producing species, rich in anti-inflammatory Akkermann's muciniphilia that strengthens the intestinal mucosal barrier. This gut microbiome dimension explains why the dietary changes we are recommending do not produce their full benefit in the first few days. The microbiome takes 2 to 4 weeks to shift meaningfully in its composition, which is why the research on dietary intervention in arthritis consistently finds that the greatest improvements in inflammatory markers and joint pain scores occur between weeks 4 and 12 of the intervention. Committing to the full replacement strategy for a month before assessing its impact is not a sign that it is not working, it is the timeline the biology requires. For adults over 60 specifically, there are 2 additional dimensions that distinguish arthritis management for this age group. The first is medication interaction. Many adults over 60 taking medications for arthritis, including methotrexate for rheumatoid arthritis, NSAIDs for osteoarthritis pain, and corticosteroids for inflammatory flares, have nutritional interactions that the dietary changes we are describing can improve. Corticosteroids deplete calcium and vitamin D, making the calcium in plain dairy products and the vitamin D in fatty fish especially valuable for people on steroid therapy. NSAIDs taken with alcohol, one of the 7 foods we are eliminating, significantly increase the risk of gastrointestinal bleeding. Eliminating alcohol from the diet of an older adult on regular NSAID therapy is therefore not just an anti-inflammatory dietary choice, but a direct safety improvement. The second dimension is sarcopenia, the age-related loss of muscle mass that reduces the dynamic joint stabilizers protecting knee and hip cartilage. The protein-rich replacement foods we have recommended, fatty fish, eggs, legumes, Greek yogurt, are not only anti-inflammatory choices. They simultaneously support muscle protein synthesis in older adults, providing the building blocks for both the muscle that protects arthritic joints and the cartilage matrix the joints themselves require. Now let us pull all 7 replacements together. Stop refined sugar, replace with dark berries, raw honey, and dark chocolate. Stop refined flour products, replace with steel-cut oats, barley, quinoa, and whole grain sourdough. Stop processed red meat, replace with fatty fish, eggs, and legumes. Stop omega-6 vegetable oils, replace with extra virgin olive oil and avocado oil. Stop high-fat non-fermented dairy, replace with Greek yogurt, kefir, and aged cheese in reduced portions. Stop alcohol, replace with tart cherry juice, herbal teas, and sparkling water. Stop ultra-processed foods, replace with whole foods in minimally processed forms. The nightshade vegetables, tomatoes, peppers, eggplant, and potatoes deserve a specific mention in any comprehensive guide to foods and arthritis, because they are perhaps the most commonly debated dietary topic in arthritis management communities, and the one where the popular belief and the scientific evidence diverge most significantly. The claim that nightshade vegetables worsen arthritis has circulated in natural health communities for decades, based on the presence of alkaloids, including solanine, in these foods, which in laboratory conditions have demonstrated some inflammatory activity. The clinical reality is more nuanced. For the overwhelming majority of adults with arthritis, nightshade vegetables do not worsen joint inflammation, and in fact, the tomatoes, peppers, and eggplant in this category are rich sources of the anti-inflammatory polyphenols lycopene, vitamin C, and carotenoids that support the anti-inflammatory dietary environment we have been building throughout this video. A systematic review examining the relationship between nightshade consumption and arthritis symptoms found no consistent evidence that nightshade vegetables worsen arthritis in population studies, while noting that individual sensitivity responses are possible and that tracking personal symptom patterns is the most reliable way to assess whether a specific food affects any given person's arthritis. The practical implication: do not eliminate tomatoes, peppers, and eggplant from your arthritis diet based on the popular nightshade narrative, unless you have specifically observed through a systematic elimination and reintroduction protocol that these foods reliably worsen your personal joint symptoms. For most adults over 60 with arthritis, these vegetables are net anti-inflammatory contributors to the diet, and removing them makes the overall dietary picture less protective, not more. There is another commonly consumed food that deserves mention as a seventh and a half item, one that most people over 60 do not identify as inflammatory, but that recent research as increasingly implicated in the inflammatory mechanisms relevant to arthritis. That food is the artificial sweeteners found in diet sodas, sugar-free products, and the sweetener packets used daily by millions of adults who have switched from sugar to zero-calorie alternatives in an effort to reduce their glucose and caloric intake. We discussed in our 9 Regret Foods video the research published in the journal Nature documenting that the most commonly used artificial sweeteners, saccharin, sucralose, and aspartame, produce significant disruption of the gut microbiome in human participants, with the specific microbial changes associated with glucose intolerance and metabolic dysregulation. In the arthritis context specifically, the microbiome disruption produced by artificial sweeteners reduces the populations of butyrate-producing bacteria that we have identified as the gut microbiome's primary anti-inflammatory contribution to joint health, meaning that the adult over 60 who switched from sugar to artificial sweeteners to reduce their inflammatory sugar intake may have inadvertently replaced one arthritis-worsening dietary choice with another that operates through a different but equally relevant mechanism. The practical implication for adults over 60 with arthritis is to treat artificial sweeteners with the same caution as refined sugar in the context of joint health, not as a safe, unlimited alternative, but as a substance whose impact on gut microbiome health and systemic inflammation warrants moderation or avoidance, particularly in the presence of established arthritis, where every component of the inflammatory load matters. The practical daily meal pattern that emerges from the 7 food replacement strategy we have described, combined with the 7 morning foods from our prevention video and the 7 bedtime compounds from our arthritis relief video, creates an integrated daily dietary architecture for adults over 60 managing arthritis that addresses morning inflammation, daytime nutritional support for joint tissue, and nighttime repair facilitation simultaneously. Breakfast: the anti-inflammatory morning protocol: eggs, oatmeal with berries, Greek yogurt, walnuts, morning turmeric drink, warm lemon water. Lunch: a Mediterranean pattern meal, generous salad with olive oil dressing, a protein source such as fatty fish, canned sardines, or legumes, whole grain bread or brown rice, and an additional serving of colorful vegetables. Dinner: lean protein, poultry, fish, or plant-based with a large portion of anti-inflammatory vegetables, a side of fermented foods such as kimchi or sauerkraut, cooked in olive oil or avocado oil, and a glass of tart cherry juice or herbal anti-inflammatory tea in the evening. Before bed: the golden milk, magnesium glycinate, tart cherry juice, and collagen peptide protocol from our arthritis bedtime video. This complete daily dietary framework, from the first glass of warm lemon water in the morning to the last capsule of magnesium glycinate before sleep, is the most comprehensive evidence-supported natural arthritis management protocol available to adults over 60. It is not a replacement for medical treatment where medical treatment is indicated. It is the dietary foundation upon which medical treatment works most effectively, and the platform that gives your joints their best possible chance at the lowest possible daily inflammatory burden. The 7 foods to stop eating are the holes in that foundation. Every day you continue consuming them, you are undermining the anti-inflammatory work that the rest of your diet is trying to do. Every day you replace them, you are reinforcing the foundation, adding to the accumulated anti-inflammatory effect that, over weeks and months, produces the meaningful and measurable reduction in arthritis pain and joint inflammation that the research consistently documents, and that your joints are asking for every single morning, when they tell you, in the language of stiffness and pain, that the inflammatory environment they are living in has become more than they should have to bear. You now know what to stop. You know what to eat instead. You have the complete picture. Use it. The nightshade vegetables, tomatoes, peppers, eggplant, and potatoes deserve a specific mention because they are perhaps the most commonly debated dietary topic in arthritis management communities. The claim that nightshade vegetables worsen arthritis has circulated in natural health communities for decades, based on the presence of alkaloids including solanine. However, a systematic review examining the relationship between nightshade consumption and arthritis symptoms found no consistent evidence that these vegetables worsen arthritis in population studies. For most adults over 60 with arthritis, tomatoes, peppers, and eggplant are rich sources of anti-inflammatory polyphenols lycopene and vitamin C, net anti-inflammatory contributors to the diet. Do not eliminate them based on the popular nightshade narrative unless you have specifically and systematically observed that these foods worsen your personal joint symptoms. Artificial sweeteners found in diet sodas, sugar-free products, and sweetener packets deserve mention as a 7.5 problematic food. Research published in the journal Nature documenting that the most commonly used artificial sweeteners, saccharin, sucralose, and aspartame, produce significant disruption of the gut microbiome, reducing the populations of butyrate-producing bacteria that are the gut microbiome's primary anti-inflammatory contribution to joint health. The adult over 60 who switched from sugar to artificial sweeteners to reduce inflammatory sugar intake may have inadvertently replaced one arthritis-worsening dietary choice with another operating through a different but equally relevant mechanism. Treat artificial sweeteners with the same caution as refined sugar in the arthritis context. The practical daily meal pattern that emerges from the 7-food replacement strategy creates an integrated daily dietary architecture for adults over 60 managing arthritis. Breakfast, the anti-inflammatory morning protocol: eggs, oatmeal with berries, Greek yogurt, walnuts, and a morning turmeric drink. Lunch, a Mediterranean pattern meal with olive oil dressing, a protein source such as fatty fish or legumes, and colorful anti-inflammatory vegetables. Dinner, lean protein with a large portion of anti-inflammatory vegetables, a side of fermented food, cooked in olive oil or avocado oil, and a glass of tart cherry juice or herbal anti-inflammatory tea in the evening. Before bed, the golden milk, magnesium glycinate, and tart cherry juice protocol from our arthritis bedtime video. This complete daily dietary framework is the most comprehensive evidence-supported natural arthritis management protocol available to adults over 60. It is not a replacement for medical treatment where medical treatment is indicated. It is the dietary foundation upon which medical treatment works most effectively, and the platform that gives your joints their best possible chance at the lowest possible daily inflammatory burden. For adults over 60 managing arthritis, with prescribed medications, to specific interactions are worth knowing. Corticosteroids deplete calcium and vitamin D, making the calcium in plain dairy products and the vitamin D in fatty fish especially important in the diet of people on steroid therapy. NSAIDs taken with alcohol, one of the 7 foods we are eliminating, significantly increase the risk of gastrointestinal damage. Eliminating alcohol from the diet of an older adult on regular NSAID therapy is therefore not just an anti-inflammatory dietary choice, but a direct safety improvement that should be discussed with the prescribing physician. The connection between the 7 inflammatory foods and the specific biomarkers your physician measures at checkups: C-reactive protein, erythrocyte sedimentation rate, rheumatoid factor activity, and joint imaging findings is direct and reproducible. Adults over 60 who implement the 7-food replacement strategy consistently over 12 to 16 weeks and then have their inflammatory biomarkers retested frequently find measurably lower CRP and inflammatory cytokine levels, evidence that the dietary change is producing the biological effect it is designed to produce, visible in the same laboratory measurements their rheumatologist or primary care physician uses to track their disease activity. This is not an anecdotal claim. It is the documented outcome of the dietary intervention research we have cited throughout this video, and it is the outcome that makes the dietary change from the 7 inflammatory foods to their anti-inflammatory replacements one of the most evidence-supported and most measurably effective non-pharmacological interventions available to adults over 60 managing arthritis. The 7 foods to stop eating are the holes in your joint protection strategy. Every day you replace them, you are reinforcing the anti-inflammatory foundation that your joints need and deserve. You now know what they are. You know what to eat instead. Use that knowledge starting with your very next meal. This is not a deprivation diet. It is a substitution strategy, one that trades the inflammatory inputs your arthritic joints cannot afford for the anti-inflammatory alternatives that provide equivalent satisfaction, with dramatically less joint damage. Every meal that reduces the inflammatory load on your joints is a vote for a less painful, more functional tomorrow. The research is clear. The mechanism is understood. The replacements are available. And the only thing between where your arthritis is today and a meaningfully less inflamed version of that same condition is the consistent daily choice to stop feeding the fire. If this video gave you a specific practical, food-by-food replacement guide for managing arthritis over 60, please support this channel. Hit the like button right now. Subscribe if you have not already. Share this video with someone over 60 who is managing arthritis and does not know about these 7 foods. And leave a comment below. Tell us which of the 7 foods is the hardest for you to give up and which replacement you are going to try first. We read every comment. Your experience matters to this community. Thank you so much for watching. See you in the next one.